Knock knock. Hi, my name is Jazzy. I'm going to be a student nurse today. Today we're going to be doing a quick head-to-toe assessment. It'll probably take about 10 to 15 minutes. Do you have any questions before I begin?
No.
Okay. And then can you start by giving me your name and date of birth, please?
My name is Jazelyn Herrera and I was born 12/05/2003.
Okay. And then do you have any allergies I should be aware of?
No.
Okay. Just upon observation, patient is sitting upright in no acute distress. Patient is alert with no visible lines, tubes, or drains. Posture and hygiene are appropriate to the weather, and then mood and behavior are calm and cooperative. And then can you tell me if you're having any pain today?
No.
Okay. And then I'm going to ask you a couple of questions that might seem a little bit silly. Can you go ahead and start by telling me what your name is?
Jazelyn Herrera.
Okay. And then do you know where you are today?
The hospital.
Do you know what day it is today?
October 30th.
Okay. And then can you tell me who the current president is?
Donald Trump.
All right. Patient is alert and oriented ×4. And then can you smile for me? Okay. Patient's face is symmetrical with no drooping. And then can you repeat the phrase after me? It's a sunny day in Springfield.
It's a sunny day in Springfield.
Okay. Patient has clear and articulate speech with no slurring. And then can you squeeze my hands as hard as you can? And then pull towards you, push away from you. Okay. Strength is equal in both upper extremities. Now your feet, push down, and then push up. Okay. Strength is equal bilaterally in the lower extremities. I'm gonna have you close your eyes and tell me where you feel me touching.
My arm. My other arm. My leg. My other leg.
Okay, senses are intact and equal in all extremities. Now I'm going to go ahead and assess your scalp. Sorry. Okay, scalp is clean with no lesions or abrasions. There are no infestations and hair is evenly distributed. Now I'm going to go ahead and shine a light in your eyes. Pupils are equal, round, reactive to light, and accommodation. And then I'm gonna take another look. Okay, eyes and eyelids and lashes are clean, conjunctiva is pink, and the sclera is white and moist. Now I'm gonna go ahead and take a look at your ears. Ears are equal in size and shape with no visible drainage. Now I'm going to go ahead and have you cover one nostril at a time and then breathe out. Okay. Okay, nostrils are padded with no flaring or drainage. Now I'm going to take a look in your mouth. Okay, oral mucosa is pink and moist, teeth are intact and clean, and tongue is midline with no lesions. Now I'm going to go ahead and press on your fingernails. Okay, capillary refill is equal in less than 3 seconds in the upper extremity. Okay, capillary refill is less than 3 seconds and equal in the lower extremities. Now I'm going to go ahead and check your pulses. I'm going to start by testing your brachial pulse. Okay, pulses are equal and strong bilaterally in the brachial pulse. Now your radial pulse. Okay, pulses are equal and strong bilaterally on the radial pulse. Now your pedal pulse. Okay, pulses are equal and strong bilaterally in the pedal pulse. Now I'm going to go ahead and listen to your heart sounds. I'm going to start by listening to the aortic pulse at the right sternal border, second intercostal space. Now I'm going to listen to the pulmonic at the second intercostal space, left sternal border. now I'm gonna listen to the herbs point at the third intercostal space, left sternal border. Now the tricuspid at the fourth intercostal space, left sternal border. Okay, now the mitral or apical pulse at the fifth intercostal space, midclavicular line. Okay. S1 and S2 sounds are present with a regular rate rhythm and no murmurs. Now I'm going to go ahead and inspect your neck. If you could go ahead and lean back. Okay, no apparent jugular vein distension. And I'm going to go ahead and check your carotids. Feel your neck. Now I'm going to listen. Okay. Pulses are equal, no bruise heard at the carotid arteries. I'm going to go ahead and take a look at your respirations. I'm going to go ahead and count them. Okay, breathing is even and unlabored. Chest expands symmetrically with normal rate rhythm and depth. Okay, now I'm going to listen to your lungs, and then you can go ahead and take deep breaths in and out through your mouth. We'll start on your front side. Okay, and then your back. Sounds are clear auscultation with no crackles, wheezes, or bronchi. And then do you currently have a cough, or are you coughing up any fluids? Okay. Then I'm going to ask you some questions about your digestive system. When was your last bowel movement?
Today.
Okay, and then have you had any constipation or diarrhea? Okay, and then have you recently had any issues with urination?
No.
Okay. Now I'm going to go ahead and have you lay flat on your stomach. Okay, I'm going to take a look at your stomach. Okay, just upon observation, abdomen is flat with no apparent pulsations or distension. Skin is moist and dry to the touch with skin color that is appropriate to ethnicity. I'm going to go ahead and listen to your bowel sounds. Okay, bowel sounds are active and present. I'm going to go ahead and palpate your stomach and then let me know if you feel any pain or tenderness. Any pain or tenderness? Okay, abdomen has no apparent masses and is non-tender. Okay, now you can go ahead and sit back up. Okay, now I'm going to check your range of motion. Can you go ahead and raise your head up to the sky and then down to your chest? Okay, patient has full range of motion in their neck. Now go ahead and raise your arms up and then down to your toes. Okay, patient has full range of motion in their spine. I'm going to check your arms, then your wrist, and then your other arm, then your wrist. Okay, patient has full range of motion in their upper extremities bilaterally. And now your leg, ankle, other leg, ankle. Okay, patient has full range of motion in their lower extremities with no notable crepitus or pain in all four of their extremities. Okay, now I'm going to go ahead and have you stand up. And then take a few steps forward and a few steps backwards. Okay, and then patient has a steady balanced gait with coordinated movements. And then that's all I have for you today with this head to toe inspection. Do you have any questions for me?
Nope.
Okay, thank you for letting me do this assessment on you.